Hello and welcome to another session of ICAAC Live, coming to you from San Francisco, California. I'm Jeffrey Fox, your host for many of these sessions, and I'm the features editor of Microbe, the monthly magazine of the American Society for Microbiology. ICAAC is the American Society for Microbiology's annual infectious diseases meeting. In this session, I'm going to be talking with Lynn Finelli of the Centers for Disease Control and Prevention in Atlanta, Georgia, and we'll be talking about influenza. But before we begin, I want to remind those of you who are watching over the internet or following us by the internet, if you would like to use to ask a question, please use Twitter and hashtag ICAAC or the @ASM Newsroom. And for those of you in the room who would like to ask questions, and I do invite you to join in the discussion as soon as we get going, please wave your hand, wait for a microphone, identify yourself by name and affiliation, and then fire away with your question. All right, so we're ready to start, and Lynn, if you would give a summary, a quick overview of your findings, and then we can go into some details.
Sure, thanks for inviting me. Today I'm going to talk about an outbreak of animal origin influenza, specifically H3N2 variant infection. We're interested in these infections because sustained and efficient transmission of these viruses represent opportunities for a pandemic, just like we saw with H1N1 2009. So far, in the last 9 weeks, we've had 302 infections as of last night, 16 hospitalizations, and 1 death in 10 states in the US. Cases have been associated with prolonged and close contact with swine, specifically in the context of exhibiting swine at state and local county fairs. There's been very little human-to-human spread so far, and the immunity profile of this virus shows that there's very little or no immunity in children, but in young and middle-aged adults, there is moderate immunity, and this immunity trails down a little bit in older adults. We're asking doctors to test patients with PCR quality specimens in the affected areas in those 10 states when they come into their offices with influenza-like illness, and also to treat patients, all patients, with either oseltamivir or zanamivir. Is there a risk to the average fairgoer? We think not. About 50 million people have visited state and local fairs this summer, and we see very few cases just emanating from the fair-going population. Nor do we see any cases arising from the community. However, a candidate vaccine virus, in fact, 2 vaccine candidates, have been sent to drug manufacturers in case cases start to escalate. It's hard to predict what's going to happen as both fairs wind down and as the cooler weather ensues, and it's possible that we'll see local outbreaks, maybe in daycare centers and in schools, in the exquisitely susceptible population. But we're going to be on guard and consistently monitor the situation. As you know, influenza viruses are constantly changing, and we've really enhanced surveillance and will aggressively investigate cases and their contacts.
Okay, so you say that there were so far 300 plus cases reported. Can you describe that population a little bit more fully? It sounds as if youngsters are the most susceptible, the ones who are showing up. But there was 1 death. Was that a child, or was that an older
The death was in an older adult, and this individual had many very severe underlying conditions. So far, CDC and state and local governments are recommending that people with severe underlying conditions, such as this person have, stay out of the barns. And there is signage posted at most state and local fairs to keep such people out of the barns. Unfortunately, there was a death in a person with these underlying conditions, but we are recommending that people like this stay out of the barn altogether.
Okay, and can we say something a little bit more about the geographic spread of this?
Yeah, it's very...
10 or 11 states, but is it in the middle of the country?
It's very interesting. In the U.S., we sort of have a swine belt, and I wish I could show you a picture, but in the eastern part and sort of middle part of the U.S., in the mid-east and toward the center of the country, that's where swine are concentrated, and that's where these cases have occurred, and not surprisingly, that's the most common place where pigs are shown at state and county fairs. And so those are places where children raise pigs and show them and compete for not insubstantial prizes, which many of them use to finance college educations.
So these are prize pigs that are making people sick. Is that what you're saying?
They are.
Well, but I have a more serious question about the swine population. And do you have some sense of the burden of this infection in the swine population? How extensive is it? Isn't that an important factor in figuring out how and where infections in the human population are likely to show up?
It is very important, and swine surveillance is a rather new phenomenon in the U.S. In response to the increasing number of swine flu infections in the U.S. on or around 2008, USDA commenced a swine surveillance program, and it's still in its infancy. And we have surveillance that says that H1N1 swine strain, H1N2 swine strain, and H3N2 are all circulating in swine. Although we don't have data on individual pigs like we do on humans, we have data on acquisitions, which mean that just numbers of herds. We know that these strains are circulating with some frequency, and we know that H3N2 in particular is circulating widely in the US. So we are not surprised that we see human infections of this type. Anecdotal evidence tells us from swine veterinarians and veterinarians at state and local fairs that they are seeing more H3N2 than they've seen before.
Okay, so H3N2 is symptomatic in pigs.
Yes.
It does make pigs sick.
Yes, all of these swine viruses are symptomatic in pigs. Swine flu in pigs occurs in annual epidemics, just like influenza occurs in humans. Their annual epidemic is in the fall and winter, just slightly earlier than human flu. And the symptoms of swine flu in pigs are exactly those as in humans. Runny nose, cough, coryza, lethargy, runny eyes, poor feeding, and general malaise. Secondary bacterial infections, pneumonias are common, and there's a full spectrum from mild to severe illness.
All right, so there seems to be, we have a question right away. Let's take that question. We're not going to wait for my question. It's an internet question.
Yeah, this question comes via Twitter from Helen Branswell of the Canadian Press. She wants to know, will it be harder to spot the H3 variant cases in the community, i.e. not among fairgoers, when seasonal flu viruses start to circulate?
Hi, Helen, and nice to have a question from you. We have very good virologic surveillance in the United States, and in the US, WHO and collaborating laboratories receive and process about 200,000 or 300,000 virologic samples. And all of those samples, or many of those samples, are subtyped. So since all of those laboratories have the ability to subtype samples, we'll be able to detect whether these are common seasonal subtypes or they are types of viruses which can't be subtyped, and those would be variant or animal viruses, and then could be further identified by the laboratories presumptively as swine flu viruses or other animal viruses.
Okay, I want to welcome Helen back and chide her for not being here in an earlier session, but we'll leave that for later discussion. Let me ask about, strikes me as something odd about the fact that these flu cases are showing up almost exclusively associated with state or local fairs. Maybe they're county fairs, I have no idea. But why are we talking about exposure of non-farm individuals, the people who visit the fairs, to pigs? And isn't there something odd that these prize pigs, the ones that people want to show off, are sick pigs, or is that just an accidental association?
Just imagine the pig barn like a classroom. And so here you have a congregation of very young pigs. These pigs on average are just a few months old when they're shown, 4 to 6 months. And they're susceptible because they're very young, so they don't have immunity to this virus. So they come to the exhibition being susceptible to flu, and it just takes one pig who's infected to infect the whole barn. And when pigs come, one pig comes ill, and then there's transmission among those pigs. And so when there's transmission among pigs, pigs get sick, and sometimes there's transmission to humans. And these children, these exhibitors, spend extraordinary amounts of time with their pigs in extremely close contact, sometimes even sleeping on the site of the fair and spending 7, 8, 9 days with their pigs in close proximity. So the opportunity for exposure is tremendous. And while you might not have such an opportunity for an infectious dose by just walking through the fair, these kids have a tremendous opportunity for prolonged and close contact.
Oh, so you're saying that it's mostly the children who are 4-H, the kids who are showing off their own, the pigs they've raised. It's not the casual visitor who walks through the
Correct.
Through the fair. I see. Well, I guess there's a lesson in there about not sleeping with pigs or near pigs when you go to state fairs. Jim, you have a question from the internet.
Yes, actually, we have another question from Helen. She's asking, when you say that the H3N2 variant is seen widely among swine in the US, is this the virus with the M gene from pandemic H1N1, and is that widespread?
Helen, I don't know the answer to that. I don't know whether we see, I don't know whether that virus has the M gene or not, or it's just H3N2.
And but let's talk a bit about this strain. Is it more virulent? Can you characterize it that way? Now, it does not seem to be making the real jump into the human population, that is, where you have person-to-person transmission. But is it showing up as more, making people sicker, or seeming to be more deadly or more effective as a pathogen in the human population?
I think maybe we should just take a step back and talk about H1N1 pandemic strain first. H1N1 pandemic strain, which has this M gene, which comes from the Eurasian swine gene or stock, is thought to, that M gene is thought to make that virus more transmissible, demonstrated in animal models. And so it was thought, when this M gene was demonstrated to be in the H3N2 virus, that it could confer increased transmissibility. So one study has been done so far and published in July that looked at the H3N2 virus from 2010 without the M gene, and the H3N2 virus from 2011 with the M gene, and compared transmissibility of this virus in ferrets. And it was felt by the investigators, who were sort of a collaborative group from 3 different centers, that this virus was equally transmissible, both with and without the M gene. So I think that there is not consensus that this M gene causes increased transmissibility for the H3N2 virus. But I think the investigators cautioned in their paper that more studies need to be done.
Okay, so you have a more complete, but the population group you described in your introductory remarks, 300 or plus folks from 10 or 11 states, I don't have the numbers quite right in my memory, but you made a point that the virus did not seem to be moving from person to person and breaking out into the human population. It's rampant in pigs, and it's moving occasionally, or more than occasionally, into humans. But so it's different from the 2010 and 2011 H3N2s, or am I adding in too many strains here and getting utterly confused?
I think it's confusing. In 2009, we saw the H1N1 come at some point from swine to humans. And then we saw very widespread transmission from person to person.
Right.
Right? And then this virus, we saw for the first time, this H3N2 with the M gene, we saw for the first time transmitted from pigs to humans in 2011.
Okay.
And we had 12 such cases last year. Then this year, all of a sudden, we had, in the last 9 weeks, 300 cases. All of these cases have been associated with prolonged and direct exposure. We have only seen about 10, and 10 is sort of the outside limit human-to-human transmissions.
So there have been
there's a
handful.
few,
Yeah.
and we've allowed a definition of human-to-human transmission that is very generous. And I can explain the technicalities of that if you're interested. But we've allowed a very generous human-to-human transmission because we have defined these in a way that allow us to investigate those cases in a very aggressive way. So we haven't seen very much human-to-human transmission, so we feel right now like the probability of human-to-human transmission is extremely low. So it's not like the 2009 H1N1 swine virus at this point.
Oh, for sure it isn't. But of course, one mutation and off you go, I guess. That's one possibility, right?
Well, flu viruses are constantly changing,
Yeah.
but I'm not certain we understand what it would take to make this virus transmissible.
But this sounds a bit reminiscent of the experience in Hong Kong where workers who were, where the infected animal population was chickens and other fowl, and the people who were infected with that really deadly strain of flu were the people who were most exposed to the animals. But then occasionally that strain of flu would jump into family members, right? So there's something similar going. The phenomenon is similar even if the strains of flu are very different, right?
Maybe.
Maybe, okay. That's pretty uncommittal. I'll take a maybe.
It's a very different virus and causes a fairly mild disease like seasonal flu. It's very unlike H5N1.
Ah, okay. Yeah, in that respect, it's really not. The mortality rates are really low, almost zero in one case, right?
Mm-hmm.
So as the state and county fair season wanes, perhaps this whole experience will go back into hibernation, or what do you expect to happen next, or you're just going to be vigilant?
Well, one would hope that as the fair season wanes, there won't be this nidus of infection in pigs and this constant commerce with pigs, and so then this constant source of human infection. But it's hard to predict what will happen. Last year, we had 12 cases of human infection, as I said, and we did have a couple of person-to-person cases in winter. So, as you know, flu viruses live in the hardiest way in conditions of low absolute humidity and cooler weather. So we are going to be very vigilant as the weather gets cooler in the northern hemisphere and in North America, and to look for any hint of human-to-human transmission from this virus, and any outbreaks in schools and daycare centers where children, the susceptible population, sort of mixes, to make sure that we don't see human-to-human transmission.
Okay, now I know your focus is human-to-human, but is there any sensible intervention that you can, that might be considered in terms of dealing with the swine population? It seems as if this virus is much more widespread among the pigs, and is there anything practical that can be done to stop it at that stage, so that I would think it has some economic impact on at the farm level and in terms of the healthiness of the animals? So.
I think there are swine flu outbreaks every year. This is very routine for farmers and for the industry. I think the difference here is that we're seeing transmission to humans, or detecting transmission to humans. I think in terms of reducing transmission among swine, you would probably have to ask a swine veterinarian that question.
Well, sure, okay, but that is not a strategy that CDC is. I mean, there is this One Health effort underway where there's supposed to be greater coordination between the animal health and human health professionals, and I just wonder whether there have been any discussions about trying to do things at the farm level to head this off and keep it under wraps almost.
No, there have not been discussions of that kind. Commercial swine are routinely vaccinated, and they're
for flu.
For flu, yeah.
Or against flu.
Yeah. To protect the industry. Yep. And there are various levels of biosecurity that are put in place in commercial swine venues, where the vast majority of swine are raised and slaughtered for food, but the kinds of swine that are raised and shown in fairs are a very small number of swine altogether. So
I suppose we have to look with a little bit of a different view as to the function of state fairs, that they represent a drop in that kind of infectious diseases security, because you are taking, you're by moving animals away from the farms and into that setting, there is different kinds of exposure, and you're bringing in a different human population than usual to see those animals and interact with them, and it's a danger that you don't think about. I mean, county fairs are kind of a happy place in general, and not one where you think of flu viruses jumping from pigs into human populations, but makes me think of the movie Contagion, I guess, where a very dire representation of that possibility came through. Do we have any other questions from the room? We do have a question. If you'd wait for a microphone, we'll give you an opportunity.
Hi, I'm Laird Harrison with Medscape, and I was just wondering if you could give us the context of H1N1, what's happening with that now?
Could you tell me in what respect?
Well, just as you mentioned, there was a big concern about it a few years ago. Has it kind of diminished? Is it still very much of a concern? Is it still? Are there more cases expected this year than last year? Or
sure.
Is it being routinely vaccinated against?
Sure. As you know, we had about, I guess, between 50 and 60 million cases in 2009-10 of H1N1. The following year, it continued to circulate and was about 25% of all influenza circulation. That was 2010-11. In 2011-12, we continued to see circulation, although it was a slightly less circulation than the year before. And for the past 3 years, we've had influenza H1N1A California, which is the vaccine strain included in the seasonal vaccine. And again, this year, for 2012-13, we will include influenza A California in the seasonal vaccine strain.
Okay, well, I have one more question about H3N2 before we wrap up. And
okay.
Everything you've described so far is about the emergence of this strain into a small cohort of humans in the United States. Is this phenomenon restricted to the U.S., or is it showing up anywhere else in the big wide world where pigs are grown and humans are coming into contact with them, such as in Europe, South America, or Asia, where there are a lot of pigs in close proximity to humans? I am just back a day or so ago from a meeting in Germany where there were many scientists from many countries that have very good surveillance. And so far, we have not heard of this virus detected in humans. But it is in swine in other countries.
Well, I don't know about swine surveillance in other countries.
Okay.
I only know about human surveillance. But there are efforts underway in many countries to increase testing and to have laboratories specifically rule out H3N2 variant cases among their specimens that they test. And another difference may be that we have this phenomenon of state and county fairs, and that may not be very widespread in other places, although I think it is somewhat common in Canada. But we've not heard from our colleagues there that they're seeing it. Just to point out, the very first H3N2 case in humans was identified in Canada in 2005. So we know surveillance is good there, and we think if it were there, they would identify it.
So we have to ask the Canadians to please go out and check your pigs, right? That's important, as well as your human population, of course. But Lynn, would you like to share a last thought before we end our discussion?
No, thanks. I just thank you very much for inviting me. It was my pleasure.
Okay, well, so we've been talking with Lynn Finelli of the Centers for Disease Control and Prevention, which is in Atlanta, Georgia. I'm Jeffrey Fox of Microbe from the monthly magazine of the American Society for Microbiology. We have one more session coming up in about 30 minutes on the emerging role of social media in public health. Please join us then, but for now, that's it. Thanks very much for joining us.
Explore the fundamental role of microbes in the natural history of our planet with Microbes in Evolution, the world that Darwin never saw. Available at estore.asm.org.